Hello and welcome to the Survivorship Oncology YouTube video series at Levine Cancer Institute. Today we'll be talking with Dr. Tom Rapisardo, Section Lead of the Survivorship Oncology Department. Welcome, Dr. Rapisardo.
Well, thank you for having me. Thank you for giving us the opportunity to talk a little bit about what we do.
Yes. Can you tell us a little bit about yourself and your background?
Sure. I'm a general internal medicine physician. I've been doing it literally for 40 years. And what's interesting about that is that we've always had to take care of cancer patients. The difference now is the fact that there's so many more cancer people surviving therapy. Therapy is much more complex, and trying to find a way of concisely talking about the therapies and what to look forward to in terms of potential adverse outcomes later is something internal medicine's always wanted, and that's what we're actually now trying to provide.
Yes. Well, thank you. So tell us a little bit about the Survivorship Oncology Clinic and how it can help a cancer patient.
Well, what this clinic is basically it can either be a transition clinic from active surveillance, or it can be kind of a long-term clinic for people who have more complex malignancies where there might be much more significant late effects. The point of being a transition clinic is that having done primary care, I can tell you, you see someone and they may have 4 or 5 issues that you need to address. There's very little time to go into the complexity of cancer treatment. So what we try to do in those cases is to distill all the treatment and the things to look for and pass it on both to the patient and the primary care doctor, because that treatment team is going to need the information, as is the patient. We know that unfortunately or fortunately in our society there's a fair amount of mobility. If it's not just geographic, it can actually be with insurance plans. Different computer systems don't talk to each other. So having a hard copy piece of information that you can carry with you and the primary care provider can have as well, I think is actually extremely useful. In terms of what we do in this clinic otherwise, in terms of the long-term follow-up, you may have had patients with certain types of malignancies where the treatment is much more complex. People who've had bone marrow transplants, whether they're allogenic or autologous transplants, people who have ongoing need for vaccinations and for follow-up and to track other multi-system residual from the treatment is what that clinic does. That clinic is also staffed by cardio-oncologists, so we now have cardiologists who kind of specialize in taking care of the heart after some of the cancer treatments. We have a GYN oncology clinic for those ladies who have had significant treatment either for ovarian or cervical cancers. They will need long-term care. We have a gynecologist who basically that was his specialty, and now this is all he does is follow up those patients. We now have a transition for pediatric oncology patients. It's called the Adult Survivors of Childhood Cancer. Those kids who are now young adults have either been treated in this system or are moving to our city, and unfortunately sometimes don't have a lot of records, which are pretty important in terms of going forward. So we try to help them gather those records and to pass on that information.
And that is just a lot of stuff that we do in this clinic. So as he outlined, we have the Survivorship Oncology Clinic, we have the Adult Survivors of Childhood Cancer Clinic, as well as the Cardio-Oncology Clinic within our department. Can you give us just an example, Dr. Rapisardo, of a time that you saw a patient and it made a difference in their cancer journey?
Yeah, it's actually surprising, and it depends on which level. I mean, some people, we do a fair amount of time getting family histories, and some things will bubble up in terms of family history that are somewhat disturbing. If there's a cluster of cancer cases in a family history, we suggest genetic testing, and we found quite a few patients who've had BRCA positive cancer gene status or other types of hereditary cancer syndromes. A lot of people need updated immunizations, especially if there have been bone marrow transplants. They need ongoing immunizations, which we kind of map out for them. In terms of specific things I can think of, I see some ladies who have had significant chemoradiation and will get lymphedema that sometimes is really pretty difficult to control, and we have really excellent lymphedema therapists here. I can think of several other isolated patients who literally came through their incredibly difficult cancers and their treatments, but were kind of laid low by kind of ongoing cancer recurrence anxiety and psychological issues, and we have an excellent department to help with that. And some of these patients, I will prescribe medication to help them deal with the anxiety and the insomnia. I can think of a young man who had metastatic melanoma, which 30 years ago, if I'd looked at his scans, I would have just almost be in tears, because he had metastases everywhere. And after the immunotherapy, it was essentially gone, which is absolutely stunning still to me. But again, he was incapacitated. He had lost his teeth, he was malnourished, he had issues with panic attacks and insomnia, and I'm happy to say that he is doing great at this point.
We love to hear those wonderful success stories too. That's amazing. Can you think of a pearl of wisdom to give a person who's listening to this video? What is just one pearl of wisdom that you can give someone?
I think the key is you have to have the information. One of the things that we do when we try to see someone the first time is we implore them to give us whatever records they have. You've heard the expression, the devil is in the details. It really is for this type of consultation. So when we're trying to develop a survivorship care plan, which is the one thing I would implore people to take away from this short video segment, when you're in active treatment and you're approaching the end of treatment, you want to ask your providers to generate a survivorship care plan. If you don't have that, we can generally put it together for you. But that's the document that you really need. It's kind of a history of what happened to you and what we need to worry about or not worry about in the future. So if anything, please get a survivorship care plan.
Good point. Definitely a good point. Is there any other points that you'd like to add other than what we've already discussed?
Well, I think the main thing is that I've been doing this for 40 years, and I am absolutely amazed at how successful many of the cancer treatments are. The whole point of this program is that when people come to me, I go, this means you're a survivor. You've gotten through this, So all the things we're going to talk about, I don't want you to worry about. I'm just trying to inform you. Because as they say, ignorance may be bliss, but knowledge is power. And that's what this is about, trying to empower you to take your healthcare forward and to live a normal life.
Wonderful. Wonderful point. Thank you. So there are a variety of ways that you can make an appointment with a survivorship clinic. You can talk with your primary care provider and ask them to help you make that appointment. Or you may call the department yourself and make the appointment, or you may ask your oncologist to also make that appointment for you. So to make that appointment, our number here at Levine Cancer Institute to make appointments is 980-442-2500. And we look forward to gathering more information for you and seeing you next time. Thank you.
Goodbye and good luck.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.